Hello everyone, welcome back to my YouTube channel Dr.Barki's Ophthalmology Tutorials. In this video, we will discuss about the various classification as well as the causes for proptosis. So this classification, it is compiled from various textbooks as well as some of the articles. Okay, so this classification is going to help you in making the provisional diagnosis at the end of your history taking as well as the initial examination. Okay. So you can classify proptosis as either unilateral or bilateral. It can be congenital or acquired. It can be infective or non-infective. Depending upon the onset, it can be either acute or gradual, and it can be intermittent proptosis, and it can be pulsatile sometime. When you come to the unilateral proptosis, you can again divide the causes into either secondary to inflammation or infection, secondary to trauma, secondary to vascular anomalies, tumors, systemic disorders, as well as secondary cysts and parasites. So causes which are secondary to inflammation and infection, we have orbital cellulitis, cavernous sinus thrombosis, orbital abscess, pseudotumors, and the parasites. So here the patient will have various signs of inflammation like pain, redness, or even the fever. So the various signs of inflammation will be there along with the proptosis. When it is secondary to trauma, the causes include surgical emphysema or the hematoma, which is formed in the subperiosteal region. The vascular causes, we have hemorrhage, aneurysms of the ophthalmic artery, carotid cavernous fistula, orbital varix, as well as the hemangioma. The tumors which can lead to unilateral proptosis are the dermoid, optic nerve glioma, optic nerve sheath meningioma, retinoblastoma, neuroblastoma, rhabdomyosarcoma, or it can be secondaries from elsewhere, or leukemia, and even the lacrimal gland tumors. Coming to the systemic disorders which can lead to unilateral proptosis, we have ocular Graves' disease, blood disorders, sarcoidosis, as well as storage disorders. In the cysts and parasites, we have cysticercosis and hydrated cyst. So these are the various causes of unilateral proptosis. These can happen at any age, but it can be life-threatening if it is happening in the children following neuroblastoma, retinoblastoma, or rhabdomyosarcoma, and the leukemia. And some of these unilateral cases can become bilateral over a period of time, like ophthalmic Graves' disease following leukemia or the cavernous sinus thrombosis. Coming to the cause for bilateral proptosis, we have the congenital anomalies. Most often, the congenital causes will lead to bilateral proptosis, like oxycephaly. The infective causes like cavernous sinus thrombosis can lead to bilateral proptosis. In the tumors, we have again pseudotumors, vaginous granulomatosis. There can be tuberculosis or the fungal granuloma. It can follow the ocular Graves, retinoblastoma, lymphoma, lymphosarcoma, and the leukemia. These are various causes for bilateral proptosis. If you look into the causes for proptosis in children, the most common causes are orbital cellulitis, then leukemia, neuroblastoma, retinoblastoma, rhabdomyosarcoma, optic nerve glioma, pseudotumors, and the Cruzen syndrome. Even the dermoids, orbital foreign body, panophthalmitis, and the parasitic cysts can lead to bilateral proptosis. Coming to causes of proptosis in adults, we have ocular Graves, pseudotumor of orbit, lacrimal gland tumor, secondary extension from paranasal sinus, orbital cellulitis, parasitic cyst, meningioma, lymphoma, and the orbital varices. So here I am not explaining how the proptosis is. Here you will just have to by heart these causes for proptosis depending upon various classifications, so that at once you will be able to come to the provisional diagnosis. Once you go into the details of the individual diseases, you will understand where it exactly fits and how it fits. Okay. Continuing with the causes of proptosis in adults, we have cavernous sinus thrombosis, carotid cavernous fistula, aneurysms of the ophthalmic artery, posterior scleritis, as well as orbital foreign body. So it can be infective or non-infective. The infective, we have orbital cellulitis, cavernous sinus thrombosis, and the panophthalmitis, and most of the causes which I discussed are non-infective. Depending upon the onset, again it can be acute or gradual. In acute, we have retrobulbar hemorrhage, surgical emphysema of the orbit, acute orbital cellulitis, cavernous sinus thrombosis, panophthalmitis, acute dacroadenitis, and the rhabdomyosarcoma. Gradual onset, we have craniofacial dysostosis, pseudotumor of the orbit, dysthyroid orbitopathy, orbital tumors, orbital parasites, leukemia, and the periorbital tumors. Optic nerve sheath meningioma can be of gradual onset, optic nerve glioma, ophthalmic artery aneurysms, and even the orbital varices. we have something called as intermittent proptosis, which will be there at times and it may not be there always. So the causes are orbital varices. This is the most common cause for intermittent proptosis. Most commonly it is unilateral, where there is associated dilated vessels in the conjunctiva, and here the proptosis varies with the position of the head. Okay, and the proptosis increases whenever the patient bends forward or following Valsalva maneuvers, and on X-ray or the CT scan you will find what is known as phlebolids. Okay, the other causes are the recurrent emphysema or the recurrent retrobulbar hemorrhage are the causes for intermittent proptosis. Sometimes the proptosis can be pulsating, like in case of ophthalmic artery aneurysms, aneurysm of the internal carotid artery, carotid cavernous fistula following encephalocele. So depending upon how the displacement is or how the eyeball is pushed forward, it can be axial or non-axial. So as you can see in this picture, if there is just forward displacement in the anteroposterior direction, that is called as axial proptosis. The various causes for axial proptosis are, whenever the cause is within the muscle or within the muscle cone, it will lead to the axial proptosis. So the causes are like cavernous hemangioma, optic nerve glioma, thyroid eye disease, AV malformations, orbital varices, mass lesion within the muscle cone, and even the neurofibroma. So abaxial or the non-axial, as I told, here the eyeball is not just pushed forward, but it is pushed in different direction also. In abaxial proptosis, the eyeball is pushed in different directions. Okay, so here the eyeball is pushed in upward direction along with the forward displacement. Here there is downward displacement of the eyeball. So whenever we tell about the abaxial or the non-axial proptosis, we tell like eyeball is displaced in different directions. So similarly we also tell in squint, right? So don't get confused. In squint there is no proptosis only, means there is no forward displacement of the eyeball, means the eyeball has not come out of its normal limits of the anterior orbit. But in proptosis the eyeball is displaced forward. So that I will be explaining when I take the classes on the evaluation of the proptosis. So in the squint it is just the visual axis what we will be telling about, whereas in proptosis the whole eyeball is displaced from its normal position, and depending upon how the displacement is, whether it is forward and upward, whether it's forward and downward, so depending upon the direction of displacement you can tell it as whether it's axial or non-axial. So as you can see in these pictures, here the eyeball is pushed in the upward direction, right? Here it has come in down and in. Okay, and in these pictures you can see here the eyeball has gone directly down, it is pushed down in this picture. So all these are various examples of abaxial or the non-axial proptosis. Okay, so whenever the eyeball is displaced downwards, means if you think that this is the nose and this is the orbit, so the eyeball is displaced in the downward direction, means there is something which is pushing it from above. Okay, so as you can see in this picture, the eyeball is displaced in the downward direction. So what can be the causes for this downward displacement of the eyeball? So the various causes are fibrous dysplasia, frontal mucoceles, lymphomas, subperiosteal hematoma, neuroblastoma, neurofibroma, schwannoma, and the thyroid orbitopathy. So it can be down and out. So this is the nose. So the orbit and the eyeball is displaced in this direction, down and out. So something from the superior nasal part is pushing it in the down and out direction. So what are the causes? We have dermoid, dermalipoma, and the lesions from the ethmoid and the frontal sinus. Again the proptosis can be down and in. So the nose, and this is the eyeball, it can be displaced in this direction. So the causes are somewhere here, that is superolateral aspect of the orbit. So the lacrimal gland tumors and the dermoids are the causes. So this is the clinical picture which is showing down and in displacement of the eyeball. The proptosis can be just upward displacement of the eyeball. So the causes are somewhere below. So anything in the maxillary sinus, like the tumors of the maxillary sinus or the mucoceles of the maxillary sinus, can lead to the upward displacement of the. So the lateral displacement of the eyeball. So this is the nose, this is the orbit. So the eye is just pushed laterally. So anything in the medial aspect of the orbit are the causes, like the ethmoidal mucoceles, lacrimal sac tumors, lethal midline granulomas, metastatic tumors, nasopharyngeal tumors, and the rhabdomyosarcoma. Only the medial displacement of the eyeball. This is the nose again. So the eyeball is pushed in this direction, means something there in the lateral part, like if there is a huge lacrimal gland tumor or the sphenoid wing meningioma, they can lead to medial displacement. These are the various classification which will help you to come to the probable diagnosis. So to sum up, you can classify the proptosis as unilateral or bilateral first, depending upon the cause, whether it can be infective, it can be following trauma, it can be following tumors, it can be following cysts. Okay, depending upon the onset, it can be acute or gradual in onset. Depending upon the infection, it can be infective or non-infective. Sometimes the proptosis can be intermittent and sometimes it can be pulsatile with the specific causes for them. And when you examine, in the initial examination only, you can say whether it's the axial proptosis or non-axial proptosis. So depending upon whether it's axial or non-axial, you can think of different causes. So hope this video on the various classification and the causes for proptosis is helpful to all of you. If you like my videos, please do subscribe to my channel, press the bell icon for further notification. Please do like and share my videos. Thank you so much.